You know, the treatment of periodontal disease has really changed dramatically in the 20 or so years that I've been a periodontist. When I finished my perio training, advanced periodontal disease was always treated with cut and stitch gum surgery. And people would do it because they wanted to keep their teeth, but nobody enjoyed doing it. No one thanked me for doing it when we were done.
Right.
And it was, although technically it was enjoyable to do, that's why a lot of people become periodontists, it's hard to enjoy doing it when you know that people weren't enjoying having it.
Okay, okay. So now this new laser has changed all that. I mean, is it really that different?
It's completely different
than the way it was before?
It's completely different. You know, before, when someone came in with advanced disease, they'd have a number of visits with a hygienist of scaling, 3 or 4 visits, and then they would have a number of visits of gum surgery, where we lift the gum up from around the teeth. And now with the laser, we can reverse 20 years of neglect sometimes, or 20 years of disease in a couple 2-hour sessions.
So things like no more bleeding gums, no more loose teeth, no more bad breath. These are, I mean, are these truths about what this laser can do?
Yeah,
I mean, not an exaggeration?
Not an exaggeration at all. This laser I found to be as effective or more effective at treating periodontal disease than was the old cut and stitch surgery. The laser energy first goes into the pocket and it removes diseased tissue but leaves healthy tissue untouched. If I were to take the laser and move it over a piece of newsprint, it doesn't affect the paper at all, but it will remove the ink from the newsprint, leaving the paper undisturbed. So the bacteria of periodontal disease soak up light energy very well. So the laser goes in, it kills those bacteria, and it removes the diseased tissue very selectively and doesn't touch healthy tissue at all. It's more precise than any surgeon's scalpel could ever be.
Okay, so the way it's been done, or being done nationwide, okay, is you go in, you cut it out. I mean, is that right? Or scrape it out?
In effect, what we would do is we would make an incision and lift the gum up from around the teeth. Once the gum is reflected, we could see the root of the tooth, and we would scrape the tartar off the root in a hope to remove the tartar, to remove the bacteria, and then we would put the gum back. So it was sort of removing it mechanically. But in order to remove it mechanically, it was very invasive. We'd have to open the gum and ultimately close the gum. And the act of, you know, cutting open the gum, reshaping the bone sometimes.
Very painful?
Well, not painful during the treatment.
But after the treatment, I mean, there's some downtime? Eating?
It certainly can be, you know.
And that's the old way. We're talking about the old way.
Right.
But the old way is being done every day.
Right.
And right? Is that right? Even in Long Island?
It's being done everywhere. And, you know, what's interesting is people always have a quandary. Nobody wants to lose their teeth. No one comes in and says, well, I'm okay losing my teeth. Who would want to go to work, you know, see their spouse, meet their friends, and have half their teeth missing? Nobody.
Okay.
But people would be so hesitant to do periodontal surgery because they've heard horror stories from their friend or from their spouse, that many people really make a conscious or unconscious decision to leave their gum disease untreated because they felt it would be, they'd rather lose their teeth than have that surgery done.
Okay, but that all has changed, I guess, because of this laser.
It's changed
Are
dramatically.
you the only person, I understand, in Long Island with this laser?
I'm the first periodontist on Long Island that has the laser, yeah.
And what's the downtime, by the way? Okay, so you have this laser treatment for the bleeding gums, bad breath, loose teeth, all those things. How soon can they be somewhat comfortable with their eating, chewing, things like that?
Well, they're comfortable right away. There's no, you know, we met, 2 days ago I treated a gentleman in the morning and he went to work in the afternoon. So people take a Motrin or a Tylenol after treatment. They don't have the weeks and weeks of downtime or the longer downtime that cut and stitch surgery would have.
Are people traveling a long way to see you?
Yeah.
Because you're the only guy that has the laser right
You know, I'm amazed. People are coming from Montauk all the way on the East End, from New York City and everywhere in between, passing, you know, 30, 40 periodontists in between. And it sort of gets to my point that everybody wants to keep their teeth. Who in their right mind would make a conscious decision to lose their teeth? But if it means going through having periodontal surgery, a lot of people just don't want to do that. So it's sort of a way that you can have your cake and eat it too. You can treat your gum disease without having to have surgery.